All right, good morning and welcome to this interview segment where we'll be discussing something that is very important and pivotal when it comes to our health and our hygiene. Well, we have an expert that will be doing justice to the topic on Global Hand Washing Day. I'm talking about no other than Dr. Idoteyin Enyi. She's the State Infection Prevention and Control Focal Person, Delta State Ministry of Health. Good morning, Dr. Enyi.
Good morning. Good morning, everyone.
How are you doing today?
I'm fine, thank you.
That's
Thank you
great.
very much.
So, you're celebrating, or the state is celebrating the Global Hand Washing Day. What is it all about, actually? And what's the theme for this year's celebration or commemoration?
Thank you very much. So, indeed, today is the Global Hand Washing Day, and it's celebrated worldwide. It's a global event on 15th of October. And the theme today is Be a Hand Washing Hero. This is a day that is celebrated to remind everybody that that simple act of hand washing can go a long way in terms of saving lives. So hand washing talks about washing your hands with liquid soap under running water for at least 40 to 60 seconds. Very simple, but a lot of people do not imbibe that habit. So we're trying to remind people, speak about it today, and make sure that everybody picks up this and be a hand washing hero.
Well, you said something about it being very, very simple, but people pay least attention to it. So I want to ask now, how important is the act of hand washing when it comes to aiding our health and our hygiene?
Okay, so hand washing is very important because one of we know that microorganisms don't travel, but they travel. And because of our hands. So our hands are the vehicles, the Jeep and the Lamborghinis that these microorganisms use to move from one place to another. So from my house this morning, I must have picked up some organisms, and now here I am in DBS, but I'm not dropping anything here, though. So because these organisms also cause a lot of diseases, it's very important that when we wash our hands, we're able to kill them, remove them off our hands, and then our hands are free. Most of the time we use our hands to touch a lot of surfaces, and we also touch our eyes, our nose, and our mouth, and these are avenues through which these organisms that are disease causing can enter into our body. And when they enter into our body and our immune system is not high enough, we come down with a lot of diseases. Now we're in the rainy season.
Yes.
A lot of people are coughing and sneezing. Those droplets fall on surfaces, and if we don't wash our hands, we pick them up, and then they can enter into our eyes and nose and mouth. And then you now see a lot of people coughing. You don't know, one person is coughing, it's spreading. And we have a lot of diseases like measles, like mpox, like diarrhea diseases, like pneumonia that are transmitted. But if you wash your hands, we can break that chain of transmission. So that's what we want to encourage people today. If you wash your hands, you reduce a lot of these infections. Like there's this one that when you see people with red eyes,
Yes.
you say the person has Apollo, you say let me not look at the person, let me not look at the person. You forget that it's transmitted because we touch surfaces that those people must have touched, and then we touch our eyes, not by looking at the person.
Wait, hold up a second. Wait. You just said something. I thought Apollo, it's otherwise known as conjunctivitis,
Exactly,
right?
exactly.
But I thought it's transmitted like if we have like
I look at you, no.
Eye-to-eye contact. No, that's what I always thought. Like
I'm
while I
telling
was
you.
growing up, like I have to look at the person, and then so anybody that has it, we always avoid making eye contact
I'm
with that
telling you,
person.
but it's not.
So that's not how it's
No,
transmitted.
you know, usually a lot of them, they have a lot of discharges and their eye is always itching them.
Yes.
So they'll keep scratching, and then when you go to greet them, you shake either their hands or you touch the chair or the table that they must have touched, or the door handle, because there are some surfaces that we call high touch surfaces, like handle to the door, handle to the
Yes.
toilet, your light bulb,
The lift.
the switch, the lift,
Yes.
exactly. So all those surfaces are high touch. So if you have to touch any of them, make sure you wash your hands after. So if you have anybody that has any of that and you always wash your hands, you will never have it.
Wow. Okay, this is an eye-opener. So, Dr. Enyi, how does proper hand hygiene help to reduce lots of infection? Because with what you've explained now, it's obvious that a lot of things we go through health-wise are associated with our hands,
Exactly.
where our hands have been and who they've been with and who they've had contact with. So how does proper hand hygiene go a long way in helping us reduce some of these diseases, if not all, most especially intestinal diseases, respiratory diseases, and all of that?
Okay, so like I said before, like for example now, in the morning you may have washed your hands.
Yes.
But washing your hands once is not enough, because even one microorganism, because of the way they grow, they multiply at a very fast rate. So if you have started with just 2 microorganisms on your hand, by the end of the day it has turned to billions because of their rapid division. So by washing your hands under running water using liquid soap, first of all is that the action of that soap helps to kill whatever microorganisms you must have had on that hand. And then the friction that you apply while washing your hand also dislodges those very tight, and you know there are some that are like like call you witches in quotes, that want to stick no matter how you wash your hand. So when you're washing, you apply friction, and that dislodges those microorganisms from there. And then another thing we must take note in proper hand washing is that all the surfaces of the hands must be covered. So it's not just enough to, you know, those days when we are growing up, when we want to eat, have you washed your hands? Just put our hand under the water.
So can you do a bit of a practical on how like we can properly wash our hands?
Okay.
Because some people are of the opinion that washing the hand is not just about putting your hand in water
exactly.
and bringing it out. And some of our parents, when we say we've washed our hands,
so
they're like, go and wash your hand.
exactly.
And when we were growing up, what we know how to do, what the idea we have of washing our hand is, as long as our hands has come in contact with water is washed. So can you like give us practical like right now on how, or the key areas on our hands to focus on when washing?
So I came with a hand sanitizer to show
great,
us.
perfect,
yes.
great.
So before I use it, there are areas that are frequently forgotten when we wash our hands. The first part of it is the tip of our fingers.
How about those with nails?
So usually once you're fixing nails, just know that you cannot effectively wash your hand.
Oh, wow.
That one is just it. You cannot effectively wash your hand. Another area that is frequently missed is in between the fingers.
Okay.
Another area that is frequently missed is your thumb, because it stands out away from the other. So when people do that thing, they forget that this guy is there. And then the back of the hands too are usually frequently forgotten. So these are the steps. So first of all, when we're talking about hand washing, we're talking about soap and running water. So first of all, if you're using soap and running water, you would wet your hands under with the water first before you apply your soap. But since I'm using hand sanitizer, I will just apply at least a good amount of the hand sanitizer to my palm.
So there's no particular amount of sanitizer?
So usually they say about 3 to 5 mils. A good amount that you know can cover your hands very well. So once you do that, you now do palm to palm. As I'm doing this, I'm distributing it evenly and also applying friction.
Great.
Remember, we said friction is important, and then the time we use is also very important. For hand washing, we talk about 40 to 60 seconds. And for you to do that, you're supposed to sing Happy Birthday song in your heart 2 times. So, yeah, that's for hand washing with soap and water. But with hand sanitizer, 20 to 30 seconds because it dries faster. So we have palm to palm. Then here, remember, see that I'm opening my fingers and then I'm applying friction.
Great.
And I'm also touching here and here. The same thing too with this hand. Then when I do that, I now come to the front and do this. Then my knuckles, I do this. The same thing too, I do with this. Then the tip of the fingers, I do this. I also do this. Then my thumb, in a rotating motion, applying friction, I do this. I do this. Then the last thing is my wrists. I do this. For hand sanitizer, by the time you're done this, you'll see that it's already dry and you're ready to go. But for washing with soap and water, by the time you're done, your hands are wet. So it's advised we use a disposable tissue to dab, yes, and dispose of appropriately, and then you'll be fine. So in a day, you're expected to at least wash your hands nothing less than 5 times. Okay,
great. That brings me to my next question, Dr. Enyi. Now, with this fast-paced, overwhelming, busy environment and society we find ourselves in, when, you know, sometimes we are overwhelmed because we are trying to make ends meet and all of that, what are the crucial moments or particular period that we can observe this hand washing?
Okay, so for when you know that you're walking or you're doing things and then your hand is not visibly soiled, in that, you know, there's no sand or dirt, you can actually have your hand sanitizer within your pockets. Once you come to the office, before you start greeting people or doing any form of interaction, you make sure that your hands are washed. Before you use the toilet, after using the toilet, make sure that you wash your hands. Before you eat, you wash your hands. After eating, you wash your hands. At the end of the day, before you leave, please wash your hands so that you don't carry the germs from wherever to the house. Okay. So you should make sure that before, when you come to work, before, you don't know what you must have touched in terms of the transport you use, you wash your hands. Then before going to the toilet, after going to the toilet, if you have to sneeze or cough, please, we usually advise you have a disposable tissue, but if you don't have, cough into your elbow usually. But some people, how many people cough into their elbows? Some people just being harsh, you know, that kind of thing. And you may not have been there. So when you have to greet somebody, make sure that you wash your hands before eating, after eating. And at the end of the day, please make sure that you appropriately wash your hands before going home.
Okay, so as the infection prevention control focal person in the state, I want us to narrow it down to Delta State. And you know that the floods are here, many people, evacuation, survival, it's a whole lot. What modalities have been put in place to ensure that this word, this important, will I call it gospel about global hand washing is spread to those in the rural areas and also right here in the urban areas, because it will surprise you to know that many people right here in the urban areas are not so much interested in hand washing. They'll tell you things like disease does not kill an African man and all of that. So what modalities has been put in place to ensure that this word is spread so that people get to understand that their life is in their hands?
Okay. So, thank you very much. So, part of the activities, one of which we have, come to see how we can use the TV medium to speak to our many viewers that tune in to our wonderful station. Another thing is that we have focal persons in the LGAs, and we also have focal persons in the facilities. Yes, so we have also made sure that each and every one of them is doing something in their own local, environment there to help to spread their awareness. We've given them flyers and also things that they can speak to the people around them. So in the facilities, they're all expected to do something. The focal persons in the LGAs are also expected to also see how they can spread the message around in the different dialects that they know that people can, understand. So we have flyers, we have the awareness creation that we have sent out to them that everybody's doing. So today now everybody's doing something little in their own area to make sure that everybody hears this message about the importance of global hand washing and also making sure that people imbibe the habits. And then another thing that we are going to do is that we are going to actually be going around to ensure that even as we are giving them the message that the things that they need to actually make sure that the wash hands are actually even available. So we are going to be doing some kind of assessments. Let's even see, do we have the running water, the taps, do they need to be repaired, are the taps even working? So these are something that we're going to be doing going forward to ensure that at least in our facilities where we have the patients that come in, they don't come in and take infections home that could have easily been prevented by hand washing. So these are some things that we're going to be doing going forward to ensure that everybody, yes. So it won't be that the facilities were not available. So it will be other issues, because we realize that there are other reasons people give why they don't wash their hands. Okay. They always say, "Oh, I forgot." So we have posters to remind people. Yes. Have you washed your hands today? See the different steps you must use. There's some people, especially in the facilities, when they wear gloves, they feel when I wear gloves, there's no need for me to wash my hand. But that is very wrong. Once you wear your gloves, before you wear your gloves, you must wash your hand. When you remove your gloves, you must wash your hand. Don't wash your hand while wearing gloves. Okay. The water can seep in, and then that environment will even make it more conducive for the microorganisms to even multiply faster on the hand. Oh. So never wash your hands while wearing gloves. Make sure that you wash before and after removing of the gloves. Okay, so some people are of the opinion that if you want adults to, hear something over and over and over again, go through their children. So this beautiful hand hygiene practice, is it also imbibed in schools? Have you spread the word to schools too? That's also part of what we are planning to do. Okay. We want to see how we can also go down to the schools and also see how we can give them Veronica buckets and things that they can use. Okay, those buckets that have taps. Yes, okay, exactly. Great, yeah. Great. To also make sure that the children are also heroes, because the theme is talking about being hand washing heroes. And we know that a lot of our children can usually run with it. By the time we empower the children, the parents become empowered, because the children go back and say, Mommy, this is what I learned today. That is what I learned today. Wash this, how to wash your hand and all that. And then there's also trying to put up a song that will also be fun for
like
them.
rhymes.
Yes,
Okay.
exactly. So something that we're also working on that we want to do.
Okay, great. So you talked about some of the challenges. One of them being that some people will tell you that they forgot. But I'm interested in the rural communities and rural areas right here in Delta State. What are some of the challenges that the state is currently battling with when it comes to making those that reside in the rural areas start imbibing the habit of hand washing?
Okay, so some of the barriers that we've seen, especially in the rural areas, is that there's a disconnect between the importance of hand washing and how we can prevent disease. They are like, their perception
Yes.
of the fact that, does it mean that if I don't wash my hand that I can die? They are not really connecting the dots.
So what is the
with
state
it.
doing
Yes,
now
so
to
what
correct
we
it?
want to do, because what we really realize among Nigerians is that if you really want them to imbibe something, you must show them, or let's say maybe through a video or something, showing them that harmful effect, like what happened in COVID. What a lot of people really imbibed that hand washing, that they saw the video that people were dropping dead on the streets. People were dying in their number. Nobody wanted to die.
Yeah.
Yes. So if we can bring out and show them the fact that simple act of hand washing can stop those that, because we still have reports of people from those rural areas coming down with a lot of cholera, the diarrhea diseases. If we can show them that link, something that they can see, and visually relate with, that if you wash your hand, you can actually stop that transmission of infection that can cause your child to die from, all this cholera and even all those acute respiratory diseases that kill children. So if we can bring that out in a visual form that they can appreciate, then they'll be able to really understand. Because sometimes they just say, they talk your own, this is not what is disturbing. But if we can really relate that to them and let them show that it is actually true, it's not just stories that are telling them. There are studies that have proven that hand hygiene can reduce up to 70% of infectious diseases that we have around us. So if we can bring it out and make it vivid to them, and it's not just a book story, a lot of them will connect with it. Because even if we tell them, we've been doing a lot of talking, we've been doing a lot of awareness, but then we're trying to see how can we bring about behavior change. Because it's not just about speaking. How can we actually, make sure that people's behavior change, in the community. So this is one of the ways that we want to employ, and see how we can make them connect with, and see that it's actually important, because water and soap, it's not, cost is not an issue. It's not like, it's so expensive, I can't afford.
But in as much as on your part, Dr. Eni, you said cost is not an issue, there are still some people in riverine or rural communities that cannot afford the said affordable soap, like you put it. Some people, finances are a problem. So I am sure that you must have encountered people that when you met them to say, okay, start engaging in hand washing, soap and water, they'll tell you, we've not had food to eat and you're telling us to buy soap. So how do you correct all of these impressions?
Like, why I said that, because I noticed that even some of the people that say they don't have money, they usually have soap to do their basic laundry at home.
Okay.
Yeah, so to wash clothes, wash plates, so that's soap that you have, that you use for other basic things, to take their bath. Something that almost everybody has access to, yes. So you can use it and you can actually achieve it. So that's one of the things we're trying to tell them. Try to look inwards. The little one we can do to save ourselves, let's even try first before government. We now start, hoping on to government to come in. But the little thing we can do to save our children, because our children are usually worth it. Some of us, as we grow older, we get stronger, but the children are the ones at extremes of age with lower immune system, and the ones that get more affected with these diseases. So if we can see how we can help them, the little things that we have, for now crying out to government, I think it will go a long way.
Great. So with what you've said concerning global hand washing and everything, it's obvious that it's not just the state. We are all stakeholders when it comes to the hand washing business. So how can we support the role of the government and be ambassadors in our little corner, in our own environment, to ensure that everybody around us begins to imbibe this healthy habit of hand washing?
Okay, so very important. All of us, we all have a part to play. So in our little corner, we ourselves should be seen to practice that hand hygiene, and then we should also speak to people. Speak to somebody today.
Great.
Ask the person, have you washed your hand? Show the person what to do. Remind people when somebody is going home after work. Remind the person, have you washed your hand today? When we go home, let's also speak to the people in our house. Therefore, some of us that are in avenues, maybe we are in committees or in areas where they form policies and where they can have access to funds. Let's speak up to our policy makers and politicians to support policies, support the programs that make sure that water is available, that soap is available in their various communities. There are various NGOs, people that can support to make sure that in those communities that they have hand washing stations in the schools are functional. The hand washing stations in the hospitals are also functional. Things that have to do with hand washing are also available. We can also make sure that today now on our status, we put it up on our status. Yes, a lot of people use social media. We have social media platforms, your Instagram platform. Put it out there. Have you washed your hand? Wash your hand and prevent infections. All of us can do that today and make it viral.
Great.
And then people can use that as a source of reminder to ensure that everybody washes their hand and keep on the habit, not just today, but we keep talking about it.
Okay, so before we go, I want to ask concerning the hand sanitizers. Now, first things first, are they a healthy substitute to soap and water? That's number one. And number two, how many percent of alcohol needs to be in a hand sanitizer for it to effectively remove germs, even though it's not to 100%, but at least a very large extent?
Okay, so for the hand sanitizers, they should contain at least 70% of alcohol.
At least 70%.
At least 70%.
Okay.
Yes. So you see that if you buy or you want to get one, they always usually put it, they'll say at least 70. Some have up to 90, some they'll tell you it's 90, some is 80, but the least should be 70%, and that is effective enough to kill the bacteria that we have on our hands. And then, sorry, your second?
I said how effective are they
compared to
soap and water?
So soap and water is effective. Hand sanitizers too are also effective because of the chemicals in the soap.
Yes.
So that also is very effective in terms of killing, and then the friction that we apply helps to dislodge. Then for the hand sanitizers, it contains alcohol. So once you use it on your hand, it dries up on your hands. So it also kills off whatever organisms that you have on your hands and keeps your hands safe.
Particular soaps or just basically antiseptic soaps?
No, so particular soap.
No,
any soap.
Any
soap at all.
Do.
Exactly.
Great. Great. Thank you so much, Dr. Enyi. So
before
we leave, your last words to Deltans and to the public.
So our wonderful Deltans, wonderful people listening to us, be a hand washing hero. Make sure you wash your hands and speak to somebody about the importance of washing hands. Washing hands can keep you safe, can keep you healthy, keep you nutritious, and make you vibrant at work, because you won't be sick and you'll be able to improve Deltas for all of us.
Okay, Dr. Enyi said it all when she said it can improve your life, it can improve your health, and of course you will be healthy. Thank you so much, Dr. Enyi. She is the state's infection prevention and control focal person from Delta State Ministry of Health, and she's been doing justice to the Global Hand Washing Day, which is celebrated today. Thank you so much once again for coming, for gracing our couch and of course our studio. All right, we've been discussing Global Hand Washing Day, but in all of this, I need us to understand that your life is in your hands. So do well to always observe proper hand hygiene. This will help your health and of course help your development health-wise. Thank you so much for being part of this interview segment. Stay tuned.